Okay, let's get started. We may hear a few more doorbells, but that's okay. I will make sure and let them in. Good afternoon, everyone. I'm Beth Eddings. I'm the Assistant Director of the Medical Alumni Association, and I'm thankful to have you on today's summer series session with or Dean Roger Smalligan. A few notes of housekeeping before we get started. Please be sure that you're muted during the presentation. We will have a short time of Q&A towards the end of the call. And when we move to that, you can feel free to unmute yourselves and ask your questions. I will be monitoring the chat like I always do. So if you have a pressing question and you want to drop it in the chat box, I will make sure we get that asked and answered for you. Lastly, feel free to dine during this time. We want to be respectful of your lunch hour, and we know that your time is precious. So feel free to eat while you listen and learn with us. We could not offer programming like this without the support of our annual dues paying members. If you're a member and you're here with us today, thank you for your support. And if you'd like to learn more about what a membership is and how to do that, I will have information in our follow-up email after today's session. I am delighted to welcome Dr. Roger Smalligan, who has served as Regional Dean at UAB Heersink School of Medicine's Huntsville Regional Campus since 2017. A native of El Paso, Texas, he earned both his MD and his MPH degree from Johns Hopkins University and completed a residency in Med Peds at Vanderbilt. His career has taken him from leading a rural mission hospital in the Ecuadorian Amazon for 9 years to returning to the States to serving key academic leadership roles at East Tennessee State and Texas Tech. In Huntsville, he continues to teach residents and medical students, build strong community partnerships, and serve patients through internal medicine, family medicine, and palliative care. And now I'm going to turn our time over to Dr. Smalligan.
Thank you, Beth, and it's so nice to see all of you. Thank you for joining us today. It really makes me happy to see that top row. Beth, I'm glad. I don't know if everybody's top row has the students who have joined us today as well, but I want to welcome them in particular. Each of these folks, we've got Jordan and Bridget Frank, who were on the way to us. Yeah, they were on the trip this year to the Dominican Republic. And we have Renee Abernathy, there she is. And we have Luke Frost was also on the team this year. So these are all fourth year medical students now. They were third year at the time that they went on the trip, at the very end of their trip. But it's great to have them join me today. And I'm going to call on them to share some of their experience on the trip and some of the things. I'll have a few questions for them, and I know they'd be happy to field questions that those of you who are listening today might have as well. These trips for me, they're a passion for me. I love it, partly because you heard my history that I've had the privilege of spending a number of years in rural Ecuador with my wife and family. And I thought to start us out, I would show a few pictures of our time there in Ecuador. It shows just a handful of interesting cases that we saw over the years. And that's the kind of thing that we come across on these trips as well, as we're going to very underserved and underprivileged areas on these trips. We've gone predominantly to the Dominican Republic on an annual basis, and we have thrown in some other trips that we've been able to organize to Peru and to Mexico as well over the years. These are times of for me, learning. They're great for relationship building with our students. And it's just always a fantastic time for me. I think we all learn something, the students, the spouses, others who go along to help, faculty members. So I'm going to share some of that with you. I'm going to go ahead and share my screen to get started with that. Share that, I think. Yeah, I think that's showing up. So that's just title page. Let me see which button's going to click me down to the next page. Let's see here. Yeah, so you heard that we were in Ecuador. We were in the Amazon jungle region from 1995 to 2004. These are pictures I took just as we traveled across the country. This was a lady who needed a ride. We let her jump in the Suburban and ride with us. This is where she wanted to be let off. This is Lake Kilauea. It's quite a scenic place to live. That's my daughter when she was young. She's now a speech language pathologist in San Diego. But at that time, she's there with an alpaca, and her friend Sarah, who's actually a nurse now. That's the road that we would take from Quito, Ecuador, down into the jungle region. You can see a little line in the middle of the screen there. That's the road that we would have to drive on to get down to our more jungle setting. This was the little hospital. It was run by a group called Reach Beyond. At that time, they had a different name, HCJB, but they're now called Reach Beyond. It's a Christian non-governmental organization, non-denominational. And I became the medical director there for the most of the year, about 8 out of the 9 years that we were there. That's where we lived, right behind the hospital. And you can see everything around right behind us is jungle. I remember the day we came out and there was a baby tapir out in the front yard just hanging out. And you'd sometimes hear other wild animals and monkeys and things in the jungle there, right where we lived. This is a picture I've had second thoughts about now. I don't know that I would want this boa around my children's neck next time. But thankfully the pilots whose pet it was promised me it was not going to hurt my kids. And this is shortly before we actually came back to the United States, because that's about the ages. We went with the 2 oldest ones there as babies. And the others were born there in the jungle. We worked fairly closely with some MAF pilots. These are pilots who donate their time to bring patients from the rural areas into our little jungle hospital. And they would also, sometimes if there was an outbreak, they would take us out to do an analysis and take medication and other medical staff with us. I took that picture as we were circling, just getting ready to land. And that every landing site you go to out in the middle of the jungle has been cleared by the local indigenous folks who want to have a landing strip, and they clear it with their machetes. And then they haul with some wheelbarrows that they've made to fill in the holes and make it soft, straight enough and flat enough for us to land. If you have any interest, this is a movie that was made in Hollywood about the exact area where we worked and the people groups that we worked with. It's kind of a fascinating story. It's about forgiveness, because some of the missionaries back in the early days were actually killed because of the fear. There was misunderstanding. There was no language connection early on, and there was fear that these folks were going to come and hurt their people. And so there, in the 1950s, that happened in rural Ecuador. So this is a movie, End of the Spear. Patients we would see commonly, this is a young lady who had tuberculosis. That's her mom with her. And you probably can see there a large cavitary lesion right at her right middle lower lobe area of her lung. We're one of the few areas that were really well prepared to both do cultures of TB and sensitivities, and we could manage multi-drug resistant TB as well. This young man too, I was so thankful that he survived. This is what he looked like. This was his chest X-ray on arrival, which you can imagine how sick he was, but he came through and did well. This young man came to us. He had back pain and was starting to have foot drop, and that's actually a defect in the middle of his back. He had Pott's disease, so he had TB of the spine, and that's his gibbous deformity. He goes up there and takes a 90-degree turn in the middle of his back, causing those neurologic dysfunctions. Our patients, many of them live deep in the jungle, and they would cut down a tree and burn out the middle and create these dugout canoes, and this is how they would get up and down the river. Saw a lot of common things like scabies. Here, both mom and baby had scabies here. We took care of a lot of snake bites. This caught the attention of some world experts in snake bites, and they came and we were able to do a randomized controlled trial of 3 different antivenoms in our jungle setting. This is one of the snakes that a patient brought in. When you meet one of these face to face, that's how your face may end up looking. And sadly, this young man, we almost had to do a tracheotomy on him, but thankfully with elevation and steroids and antivenom, he did okay. This is him a couple of days later, so we were very pleased that he was able to pull through. I think we do have some of this type of condition in this country as well, but this is a patient with botfly myiasis. So we put her to sleep because we were going to pull out a number of these from her body. These are, sorry, this is lunchtime and I'm showing you some of these pictures. Measles is in the news here now. This was a baby with measles that we took care of in the jungle, and I took a picture. I just thought I'd share that picture with y'all today, as we need to, be very careful about protecting our children against measles and other diseases. So that's just a quick overview of some of the things that we would take care of and we would see, and we would have medical students rotate with us down into the jungle for their tropical medicine experience. So you can imagine this gave me a real passion for allowing other medical students, once I came back to the States, to have an international experience where they can get at least a taste of what we got to participate in for a number of years. This volcano had not erupted since about 1940, and it did while we were there. A friend of mine took that picture. That's one of the few I didn't take of that series. But I want to jump in now to the global health trips that we have been having here at UAB from the Huntsville campus. And I will say, when I landed here in 2017, I think it was one of the first grand rounds that I was overseeing and presenting. Dr. Nancy Blevins, who's our director of the program of family medicine here on the Huntsville campus, said, "Dr. Smalligan, can I share about an opportunity for the students?" I said, "Sure." She gets up to the mic and she starts talking about a trip to the Dominican Republic, exactly what you're going to see here in a moment. And she gets done, and I grabbed the mic, and literally, I think it might have been my first grand rounds. And I said, "Dr. Blevins, sorry to ask you in public, but can I go on the trip?" Because she was saying, who wants to go on this trip? And she said, "Well, yeah, you're the new dean. I guess you can do whatever you want." So I said, "Okay, I'm going." And it was going to happen in just about 2 months later, I think. Well, it goes in April. I came, so it was a couple of months down the road. But I was so excited that this was already something going on. You can see I put the years there. I just realized we've been doing it for 10 years. I think she started the trip in about 2015. And it's these trips, I think, are just a great opportunity for the students to get out there and be on the front line and just show compassion, show resourcefulness and teamwork. These trips are planned over the special topics week, so the students can get credit for it. And then I have the opportunity from the dean's office to be able to provide some financial support for the students as well. They pay a portion, and from our office, we're able to pay a portion. And we're able to organize this, and I'm able to sponsor the cost of the medications that we take with us, which is great. As part of the preparation, many students, not all, but some, will take a 12-week co-enrolled medical Spanish course that we do on campus. And that's always a fun time. The first hour is basic Spanish. We'll take all comers. So everything from complete beginner to fluent. And we have one of our fluent speakers on the call here today that we'd have Luke help, and he'd be both a student and a helper to train other folks in their medical Spanish. So that's part of the prep that we do. And what I want to do is, I've got a number of pictures from this past year's trip, and I thought I would just kind of go through them. There's the Dominican Republic right there, as you know, attached to Haiti, southeast of Cuba. We do see a lot of Haitian refugees when we go on these trips. We partner with an organization called SCORE International, and they have an established ongoing clinical setup in the country, and they stay in very close touch with many of the poor, I'd say, barrios or neighborhoods around Santo Domingo, the capital. Who went this year? We had 18 UAB third years and 1 fourth year who helped with more of the organizational aspect. Our medical faculty, we had Dr. Nancy Blevins, as I mentioned. She's our family medicine. She's also OB trained, and she is the main organizer, and I really appreciate all the hard work and effort she puts into it every year. We had there's me. I was going to talk about me. And then Dr. Jose Cavo, he was one of our students when I first got here. He went on that trip that I said, "Can I go?" He went on that one. Then I organized a trip the next year, and he was also part of that one. We went to Peru and took 12 students to Peru. And he is now gone on. He stayed here for residency. Then he went on, did cardiology fellowship, and has now just joined the Huntsville Hospital cardiology team. So he's a cardiologist, and he's already beginning to take students to teach cardiology for us here in. So that's a neat circle that has been completed. A couple other people, Dr. Alice McDuffie, we were at Vanderbilt for residency together, and a PharmD and OB, local OB as well went with us. We take medications with us. We have a basic formulary that we take with us, that much of it we prepare prior to arrival. We buy it from a nonprofit called Operation Blessing in bulk, and then we have, you'll see how we pack it. We took along a portable ultrasound machine. We took along the same portable ultrasound machine we can use for echocardiograms, since we had a cardiologist. We take some equipment for minor surgical wound care, joint injections, some IM antibiotics if we need them. We do simple eye testing, and we take an abundance of reading glasses to give to those who need them. And I think rather than, we saw about 100 to 150 patients per day. Everybody got anti-parasitic. It's rampant there that everybody unfortunately has parasites. I've said we need to coordinate to take an engineering group with us and see if we can do water, clean water supply projects. That's a lot to try to accomplish in a week. This is a week project, but really the community needs this because we see recurrence of parasitic disease. Everybody gets vitamins as well. We do the reading glasses for those who need them. We spend time with the local children at each event. In the evenings, we do a little debrief session where we talk about what went well, what could we do better, and ideas to improve our performance the next day. And by the way, the students are constantly, and helpers like Bridget was great, take on different roles. Now, Bridget, we did not make Bridget the doctor. Sorry, Bridget. But many other roles were very much necessary, and she did great. And I'm going to have you guys introduce yourselves in just a second. And then we would also, what's fun at night too is just get together and play board games, card games, and hang out together. So somebody tell me about what we're doing here. Renee, start that off.
Okay. Hello, everybody. My name's Renee. So the night we got there, well, the day we got there, we got settled in to score. And then this is in like the cafeteria area. There was also a lot of like tables and chairs set up where we could sit in there. And we pretty much just organized all of our medical supplies that we brought into these like shoe hang-up things. I think that's what they're originally for. And, we put like our medications in there, labeled them, put some of the other supplies that we had in there, and like had them all labeled. And this was just like a good first night, kind of like a team bonding moment where we were all kind of getting used to each other and getting used to like working together, and a fairly easy task of organizing and putting stuff together. But yeah, it's a good night of getting to meet everybody.
Sounds good. And Renee, tell us what you're doing right now. You're a fourth-year student, and I know you're on an away. Tell us and what your plan is.
Yeah, I'm a fourth year. I'm wanting to apply anesthesia right now. I'm at Walter Reed on an away rotation for anesthesia, and it's in DC. So.
Awesome. Thank you for jumping on, even though you're on an away rotation. That's awesome. That's just another picture of how we're all spread out, working on getting things set up. This is on the bus the next day. We just load up, and we've got another whole bus load of with some interpreters and the equipment that we're going to need for that next day. And there's Renee. What are you doing here?
So in the top left picture, I am at one of our doctor stations, talking to, I think it was one of the local baseball players after one of their practices, just kind of talking to him. It was almost like a physical for him, and just kind of talking about like what he likes to do and stuff. But that was the doctor station. And then the bottom picture is me at triage, And that's the first station where we kind of ask them, what they're here for, and we give them vitamins and I think the anti-parasitic there as well.
Yeah.
And we do their vitals.
Awesome. So they come to the doctor station with that prepared. That's my wife in the middle there. That's Annie, and she came along, and she also teaches the medical Spanish course as a volunteer during that co-enrolled. And those are the glasses that are donated by the local Lions Club. And we get them all organized, and the patients come in and they try on different ones, and then the staff each of our folks are trained to know how to help them find the right glasses. And I'll let Bridget, I know, did some of that as well. I don't know if I have a picture of that. So I'm just going, it's kind of random order, you guys, of who pops up. So Luke, tell us about yourself and then what's going on here.
Yeah, so my name's Luke. I am currently on one of my AIs or away rotations here at Fort St. Houston and San Antonio. I'm applying emergency medicine. And honestly, like, mission work has been a really big driver and motivation for me kind of pursuing my career, especially in emergency medicine. But here, I love this bottom picture. These were two ladies that I was able to meet on, like, I was kind of doing, like, working with the kids, working with just like the people. I call it kind of like the social butterfly rotation that I was on, but really just like had the opportunity to build relationships with these people and ask them like about their lives and about their homes and about their children, and also get to like share the gospel with them in some cases and kind of get to know their background with spiritual things, because a lot of the places that we would set up the clinic were in local churches that SCORE actually had a relationship with. So not only was it an opportunity to kind of like meet people's physical needs, but also like talk to them about their spiritual needs as well, and just see like how open they were to those. So these were two ladies that were just like super fun to talk to. Were telling me all about like their kiddos and their jobs and just like a little bit about why they were there. I think one of them was in the medical field, but she was just kind of there for a checkup. But the people you get to meet and the relationships you get to build in such a short amount of time were just like super impactful. And then up top, that's me at one of the, I think I'm at a doctor station. Yeah. Or is that a blood pressure cuff? I'm not sure if that's a doctor station or triage, but you get to work in every station. We'll call it one of the doctor stations just for sake of talking about it. But I forget her name. She was a nurse on the trip with us. And we're just kind of discussing with this lady about, her medical needs. And it's really cool at the doctor station because as a medical student, this is one of the like only, trips that I've been able to go on where you like feel like you're actually the doctor, like you're making the decision. You've got like a pharmacy behind you that you're like choosing the medications. Obviously, like if you have questions and like you feel less comfortable like prescribing something or you don't know what to prescribe, there's like a team around you. There's the doctors are walking around and like you can ask them questions. But like the doctor station was just super fulfilling because you get to stretch those muscles and be like, here's what I want to do. And whenever you're on these AIs and things, like they're expecting you to perform at that level. So it's like you already have, a couple reps under your belt of like, here's what I want to do in a resource low setting. And like you get to impact people's lives, even with just a little bit of just conversation or a little bit of medicine. And it's just really cool.
That's great. Thank you. This is more of the same. That's two more of our students. This was kind of a fun thing. Luke, you're on. Go ahead and talk about this. Well, like we've got Renee's over there doing the same thing on the bottom right. But tell about how we just walked around to encourage people to come to clinic.
Yeah, so there were a couple times where, the volume was low, or, we were told about patients who weren't able to come to the clinic. So we would get a little team together and go do house visits or just walk around and let people know that we're doing this free clinic at the local church. And so this was a group of guys who were outside working on some like piping and like plumbing from one of the houses. And we were able to kind of strike up a conversation. I remember Dr. Smalligan was talking to them about how much hair they had, and that was fun. But just able to like really connect with some of the people and invite them to clinic. Some of them would come, and we were able to like give them the anti-parasitic, or check their blood pressure and just make them feel like loved on and cared for. But yeah, I don't know, Renee, do you have anything else?
No, I don't really have anything else to add. And like, I think you touched on it a little bit, going to like places where people weren't able to make it to our churches, like for a visit, like almost a home visit. So yeah, it was just really cool.
That may be part of that walk you're on, Renee, huh? So I've got some pictures of that. This is actually a home visit. We've got Dr. Jose Cava, the young man I told you about, that he graduated in 18 and then internal medicine with us, cardiology in Ohio, came back to join, is now teaching for us. He's doing an echocardiogram on a patient who was having symptoms. He and a group of students went to the home. This was just kind of a new diagnosis, that the kinds of things that can show up that can be very debilitating and very serious that are going undiagnosed by patients who are in these, they're in poor barrios, but they've really either they've tried or they've not been diagnosed for whatever reason. But this lady, we believe, has very active, and very, very, very painful, very difficult for her to get around in her hands. So she has rheumatoid arthritis, we believe. We were able to give her some steroids, which are going to make her feel a lot better in a short period of time, and strongly urged her to go to a specialist. We told her what type, and we asked the local folks how, where's a good clinic that we could help her get to have this truly confirmed diagnosis wise, and, perhaps get started on even better medication to help control her condition, because she's got a lot of damage to her body already. This was another home visit. Is that Jordan in the middle?
Yeah, I'm in there on that one. So hey everybody, I'm Jordan. I'm a fourth year student as well. I'll be applying family medicine this upcoming year. This is my wife Bridget, who was able to go on the trip with us as well.
Great.
But yeah, so this is similar to kind of what Luke and Renee were just talking about, just going out into the community. We'd hear about these people who truly couldn't make it to our clinic, whether that was they were working, or in this case, this older lady who truly was not mobile and able to get there. She was living with some family members, and correct me if I'm wrong, Dr. Smalligan, she was actually, these weren't necessarily her direct family, but they had kind of taken her in as the grandmother of the home. Which just kind of shows the family ties that they have down there and how important it is to them to take care of the people that are a part of their family or just kind of adjacent to their family as well. So this lady was essentially completely immobile, secondary to a stroke. And she would actually sit in a plastic chair in that room that they had cut the bottom of the seat out and placed a bucket underneath for her to use the bathroom. And that's where she would sit all day long. And then the family members would essentially roll her from that chair onto the bed for her to sleep at night. But due to just so much deep conditioning and everything that she had, she really was just, it was becoming more and more impossible for the family to move her around and get her where she needed to go. So we went in and We looked at, I think she had like a couple of foot wounds or ulcers that Luke and I were able to, kind of put some ACE bandaging, some pressure onto her lower legs due to some venous issues that she had. And then one of our physical therapists actually worked with the family to show them some techniques on how to move the patient around. And so it was just so cool to have an approach where we could help her physically, but then also help the family as well, kind of make some changes that would improve both of their quality of life while we were there. So it was really a really good time with the team.
Yeah, that's great. And like Luke was saying too, some of these families, they would ask us for prayer. And if, we would just be happy to I think this lady, before we left the home, they said, can we pray? And so we just all got together and said a prayer for her and for the family that was caring for her. So that was a neat experience. There's Jordan taken care of.
Yeah, so this is kind of similar to what Renee and Luke have already said. This is at each one of our tables, it would be us, an interpreter. We'd have somebody who was scribing for us, so writing down anything that we needed on our makeshift EMR that we put together to track our medication that we were using, and also put down a problem list just for us to track for in the future. So when we go back, we have a kind of a running problem list and what we used in order to make better adjustments for what we would do in the future. And so I can't quite remember with this individual when she came in, but essentially most of them would come in with, they would say, I have essentially grippe, which is like flu type symptoms or just the common cold. And so just for you to put a stethoscope on them, to listen to their lungs, to check their temperature and let them know, hey, this is what we think is the case. Just taking that time meant a lot, even if their condition wasn't severe necessarily.
Mhm. Nice. Just some of the typical makeshift housing. Dr. Blevins was guiding Garrett. We have a sim lab here on campus in Huntsville, and everybody goes through sim lab and learns how to do shoulder injections and knee injections. And our family medicine team here in house is very capable and does that on the job, and the students get to see it here. So we were able to help this gentleman who had severe shoulder pain, who got a steroid and with some pain medicine injected. With that same handheld POCUS machine, this is actually from the year before, but we did it this year as well. We could do OB checkups, and there's Dr. Blevins helping guide one of our young people through an OB ultrasound. Bridget, I know you did a lot of different things. You want to just share a little bit about what you did and any thoughts?
Absolutely. So, like Jordan said, I'm one of the spouses that got to come along on the trip, which was just really cool. I think for me to see, Jordan and of course everyone else that he goes to school with in action. I hear a lot about the patients and the things that he sees in the hospital and just his day to day, but I've never really gotten to experience it firsthand. So that was just really special to be able to see that, especially, they put so much time and effort into medical school. So it's really cool just to see them be actual doctors and serve people. But yeah, I got to do pretty much everything that wasn't being an actual doctor. So I got to play with kids. Me and Renee got to play with a lot of kids while we were there, which was super fun. And then I did some triaging. So took some blood pressure, got just some general information when they first came to clinic. So that way the doctors did kind of know what direction they were going in for their conversation with them. I handed out the glasses like Dr. Smalligan talked about. And on top of that, I got to do some scribing for Jordan at one point, which was really just sweet too, to be able to do that with him. So yeah, I really got hands-on experience on a lot of different things, probably even more so than some of the medical students in terms of just rotating through every position possible. And so that was just really special for me to be a part of, and also just a really cool way for me to serve too. And so I really enjoyed getting to do that and meet a lot of amazing people in Dominican. They're such kind people, and so it was a really cool experience for me.
Fantastic. And remind me your background, Bridget.
Yeah, so I actually have my master's in social work. So I've worked in a hospital setting and mental health settings over the past couple of years, but primarily in social work. So obviously not too far out of the realm of the things I get to do too, which was really sweet.
Fantastic. Thank you for sharing that. This was the last clinic we did that week. And this was the first time I've been going all these years since I guess I got here in 17. I went in 17. And so I've been every year since, except for I think we had to have a 2-year break during COVID because they were not allowing people in the country. But this was the first time I had been to this location, and they set us up to set up a clinic for an opioid treatment home. And all these young men, middle-aged men, older men, are recovering from their opioid use disorder. And it's a very well run, very well staffed, huge place. This is just a very small, what you're seeing there is a very small group. I mean, we saw, I don't know how many patients we saw that day. I bet we saw at least a couple of hundred because it was crazy busy. And we, had some very interesting things to take care of, but it was very touching to hear the stories of these young men. Predominantly, there's some women as well. They're not in that picture, but there was a group of women as well who are also receiving treatment. And I thought it was really special to give them a word of encouragement, to give them a quick physical, to treat them. Many of them had blood pressure, some had diabetes problems, things that we could address with the medications we had taken. So that was, to me, that was a very special experience. Deslin was on the trip I think 2 years ago or last year. And she's now doing pediatrics at Cincinnati, one of the top in the country. She's awesome. And she was doing eyes at this time. And I just remember this gentleman, he was so thrilled. She gave him a little Bible to see if he could use, if these are the right glasses for him. He started reading, he wouldn't quit. He was going to read the whole Bible because he said, I haven't been able to read in so long. This is amazing. And so she was just allowing him some time to enjoy and then send him home with that new pair of glasses. So this is the final picture I have of this for this talk. And I want to just, while this is showing, you can pick out all of the people who've spoken to you today, probably in there somewhere. But I just want to say that what impresses me every single year is just the amazing people that we have at UAB and as medical students and faculty for that matter. Because I just see them on this trip, just give of themselves and of their time, of their money, of their skills, and to see them do whatever is needed is really unbelievable. I mean, and I always come home every single time, and I hope nobody blows it like next year because nobody complains. I mean, they just work and they just get it done, and I don't care if something needs to be carried or packed or cleaned up or washed up or whatever. I mean, you can imagine all the crazy things that can happen in a clinic. And these young people they just go for it. And it makes me so proud to be a part of them. And I can tell you that this picture contains some of the people from the opioid treatment center. And they just could not, they said, we've had different groups come here over the years. They said, we've never seen a team like this. They were just super impressed and very touched. And they could tell that our people loved and cared about, their people. I do want to tell you a couple of things that we emphasize for the team. And that is that we want to be on all of these trips and whatever country, we want to be very respectful of the local health personnel. And we never want them to feel like, we think we are the American specialists who are coming here to tell them how to do things. No, we're here to help. And we try to build, and the students did too, as they served as doctor, we want to build up what contact they do have with their health system. We're like, look, here's the blood pressure medicine that's going to help you. We understand there's a health center at this location. We really want you to get plugged in there. Take this medication with you. They're going to have something similar. So we really tried to build that up and try to get the patients to get plugged in to their local system for follow-up. Meanwhile, we also try to connect with organizations that have that knowledge and some capacity to meet the needs that we're not, because we're just there for a week. And they keep track of these, and some of our more serious patients, they're going back and checking on them, and they're trying to get them plugged into local services as needed. These groups have been known in the past. We've taken up collections. We took up I believe we raised a couple after people have already paid to go, students and other people who are part of the trip gave about $2,000 this year that I was able to send back down there to help with some of the needy patients that we took care of while we were there. And that was really special. So that's pretty much what we did. And I wanted to first see if there are any questions in the chat section. And if not, I have a few questions I thought I might ask the students to talk about just based on their experience.
So one of our questions that we received is really just this work is amazing, and how can our audience, or I know we have some of our School of Medicine staff members on here with us as well. How can we support your trips in the future? Are there ways to collect supplies or funds, or how do we stay plugged in as far as supporting this work?
That is a great question, and I thought about that. We did establish a few years ago, early in this 10 years of doing this, we've had different people in the community and doctors who've wanted to contribute because it is expensive. Plane tickets have gone up quite a bit, and so even though I can help some, it's still the students are pitching in sometimes between $600 and $800 to go on this trip, or maybe a little bit more. So it is, and everything that we can provide for them, we love to facilitate it. So we did establish a local fund here on the Huntsville campus. It's a UAB fund that people could donate to support the global health trips. That's one thing we do. I'm fortunate that when I'm asked to cover hospice and palliative care at the hospital, I'm able to shuttle any funds that they've given me for that purpose into this fund to help finance these trips. But no, we would love that. I'm sorry I don't have a QR code or anything for you right now, but I could if I can find out anybody that's interested, I can certainly connect them to be able to donate to a tax deductible fund for that.
That's great. And we can, if there's a link, I can send it out in a follow-up email and kind of just get it out to everybody also. A couple other questions. Are these, like when you go on a trip like this, are they advertised out into the community? Does the community know you're coming in any way, or is it all word of mouth? And then have you been able to reconnect with patients that you maybe have seen before on previous trips and get updates to maybe any of their conditions?
Those are great questions. And what I have found is that it has varied a little bit year by year, somewhat based on the staff that are taking on our trip through our connection in the local site. Typically, they are well publicized, and that's why we have 150 to 200 people lined up when we get there. This year was not as well advertised. That's why we were walking around town letting people know, hey, a few of us did that while the others were in there busy seeing patients. And I think I'm going to emphasize that next year with the group that we connect with and say, can you please do more advertising so that everybody in your community knows it's happening? Because I think that's a good pickup, whoever asked that, because we did sense that we didn't have as much advertising this past time as we would like. Did that answer both the questions?
That was one. Have you ever reconnected with a previous patient from another trip to see an improvement in their condition?
Yes. A couple of years ago, I told you about we raised money this year. And then a couple of years ago, we had a specific young man. He was a teenager who had a non-union fracture of his tibia and was basically on crutches, very depressed. And we were able to raise some funds and send it down there. And the organization was able to then, with that money, take him to the right hospital with the right orthopedist and get him operated on. And we got feedback showing us that he'd had his surgery. He's now walking. He's doing fantastic. So that was really special. This year, we've sent this money to help some of the ones that we took care of. But our feedback will probably be more through the organization who continues to maintain contact in the villages where we've been. To be honest, there are so many needed villages that I don't even know, in the 8 years and going to a different village every single day, I can't even be sure that I have repeated. That's how many that have need. And they try to get us to the ones that haven't had a team come and help them recently. So I think that's why we keep getting into new ones. So not as much follow-up as I would like.
Sarah Mays had a question.
Hi. I am at MS1 and I'm set to rotate on UAB's campus. I was wondering if the trip is open to non-Huntsville students.
That is a great question. I meant to mention it, and I don't know if I can point them out, but yes, we take from every campus. And every year, and I love it because that's my only chance to meet you guys from another campus. I love that I know my 35 to 40 students on the Huntsville campus, and I get to know them. But it's on this trip in 7 days, we just love getting to see people from the Birmingham campus. Usually, to be honest, it's usually one or two from either Birmingham or Montgomery campus or Tuscaloosa. We've had Tuscaloosa as well. This past year we had Tuscaloosa. So yeah, you can still sign up. Anything else, Beth? I had a couple of questions. Let me see if I'll pick out. I don't want to ask all. We don't have time for all of these questions, but
We do have one more
okay.
before we hop to that. Are they open to first and second year students?
No, sorry. This is for third and fourth year because we want you to come with the skills to now, so we don't open it to first and second because we have a lot of demand in the third and fourth years when you've had a little bit more clinical training at the end of your third year. So that's a no. There is a group that goes between first and second year. I see Renee shaking her head. Did you happen to do that trip, Renee?
Yeah, Luke and I both went on that trip. It was through CMMA, and it was the fall break week of my MS2 year. So I think that they do a summer trip. Luke, you might be able to speak more on that.
Yes, they do a summer trip that can be 1 or 2 weeks, just depending on how many students are wanting to go. They try to make it 2 weeks, and then they also have implemented a fall one. I believe we were the first group to kind of advocate for that fall trip. So if you're interested in that as a first or second year medical student, you'll be less like there's less autonomy because you know less, and because like you don't have as much skills because you haven't done 30. But it's a really good opportunity to work with some of the physicians that you may be working with in the future, and again, like get a little bit more autonomy than you would have had up to that point. So they're not like throwing you to the wolves, so to speak, but it's definitely a great opportunity to have some exposure and say, is this something that I would want to do for a year? Is this something that I'd want to like do long term? Like Dr. Smalligan has explained, really good exposure there.
I will say we've had 2 students over the years that one is currently working at a mission hospital in Africa, and another, I believe, is working in Honduras right now. They had that tendency, I think, prior to this mission trip, but they just loved it, and they were, great performers like everyone else. And now they're doing that full time after their residency. So how about, I already bragged on how you guys did all of this, but can you guys talk, anybody want to say anything about how this trip required you to practice you being flexible, teamwork, adaptability? Anybody want to comment on that?
I can say something about that. I'll say, like, because I've had 2 interviews, like, because I'm military, we do our interviews a little bit earlier. And I've had the opportunity to kind of, like, I've been asked a lot about these mission trips that I've done. And it's exactly what Dr. Smalligan was asking, just about the team mentality, the flexibility that's necessary whenever you go on these trips. And that's something that's big in the military too, but it's something that's big, I think, just in any sort of medical realm or any specialty that you choose. You're going to work with people that are different from you. You're going to have certain resources at certain hospitals that like you're not used to, and definitely like the island time, the schedule, not knowing where you're going or how many people are going to show up. We definitely practiced a lot of flexibility, but the thing about the group that we went with was that, everybody was joyfully flexible. That was our motto for the week, was being joyfully flexible. And everyone really bought into that because, there were certain days where we thought we were going to one place and we ended up going to another. Certain days where, we had that medication yesterday, but today we're out of this prescription of metformin or this dosage. So we kind of got to be creative in how we prescribe these medications. Or maybe like one patient really needs this medicine. So like, and they don't have good follow up. So we'll give them a little bit more of this. And this patient does have like somewhere they can go. So maybe we give them a little bit less because they're going to be able to follow up the next week. It's really just like you get to practice those real world scenarios. And it's something that I've been asked about multiple times in some of my interviews. So
Nice.
people like really enjoy hearing these stories. It's something that like has been really impactful and like growing my own characteristics of joyful flexibility is something that you're going to take with you. If you are a medical student, you get to practice and doing that on your AIs where you're in unfamiliar territory. And when you've been on some of these trips where like you've experienced it in a very different way than where you're going to experience in AIs, it makes the AIs seem a lot easier because it's not the DR. Not that that's a bad place, but like you've already done it. You've got those reps under your belt.
Thank you, Luke. And that kind of, you've alluded to it. So is there anybody of the four of y'all that want to talk about something that was really either difficult or hard on the trip that, and how you dealt with that, or if you learned something through that?
Yeah, I can talk, I guess, maybe about probably the biggest thing that was hard for all of us was just language barrier is difficult when you were trying to establish a diagnosis or provide empathy or any of those things that we get taught inside of medicine that are so crucial to building rapport with people. I think that when we first went down there, obviously we're all a little bit nervous because we ripped the Band-Aid off a little bit, and that's largely due to Dr. Smalligan and some of our attending saying like, hey, you guys are going to make the final decisions down here. And so you're already a little bit nervous about what if I make the wrong decision, or what if I choose the wrong medication, or all these types of things. And then on top of that, how do I communicate to these people that have legitimate concerns if I don't speak the language and all these types of things? And so I think kind of what Luke was saying is you go into it with more of the mentality of instead of saying, oh, well, what are all the things that could go wrong? You kind of walk into it with, man, what an opportunity that I have to enjoy this with the people that are around me. And it really does smooth over so much faster if you walk into it with this idea of we're gonna get this done today. No matter what, we're gonna get it done. And so it almost things work out in ways you don't expect because you're willing to be flexible. And so, yeah, working with the translators and talking to these people that you're just making an effort with, it really makes all the difference, and a lot of your doubts kind of go away pretty quickly.
That's great. Well, thank you all. And Beth, I think we're probably getting close to end of time.
We are. We've got about 5 minutes left. If there's any other questions from the audience or anything the students want to share as like a final, how this impacted you, and what your choices are moving forward, we can kind of end on that, and then I'll give a brief wrap up and we'll call it a day.
I'll say one thing that was like, hard for me. And I see the question, so I'll make it quick. But like seeing the patient that me and Jordan saw with Dr. Smalligan, like just thinking about follow-up and like, hey, how is this patient going to get care like after we leave? Like we have a day here at this clinic. Like what's going to happen to them if we're not, following up? Like because we're not here next week, So, but I'll say having gone on this trip twice with different like senders each time, but through the same ministry of SCORE, they have something really cool. Like they're following up with these patients. If there's somebody that we're concerned about, we can tell school, hey, we really want to check in on this person. Can you make sure that they get this? Or hey, we want to send them money because they need resources to go and get this surgery. And like I've heard from the translators who have deep connections with these pastors who are like leading the community, or going back and following up with the patients with a different group. The patients get really good care, and it's just like reassuring every time I go. Like, hey, if there was a concern that we had for follow up, like they're getting seen. So it makes me feel a lot like more fulfilled in what I'm doing. I just want to.
Great. Thank you, Luke. I saw the question about residents. We often do take 1 or 2 residents with us. We don't go heavy on residents because they will be also more like serving like the attendings. We're roaming and helping, making sure that medical care is appropriate. And I do want to mention too that this is open to people from all backgrounds. This is not, even though we do partner with a Christian organization, we have had Hindu and Muslim students with us as well, and they've had a fantastic time. And I've gotten nothing but good reports from them as being a part of it as well. They, certainly do not have to participate in any, Christian aspect of it if you don't want to. We do ask everyone to respect the culture and the, what the organization we're working with expects from a cultural standpoint. So, and people have been very open to that. But yeah, we do love to have a resident or 2 with us. This year we didn't get to have one, but usually we do have 1 or 2 residents as well. And I just want to say thank you so much for your attention, for your interest. And I see a number of people I know, and I appreciate you coming, Ping, Dr. Wheat, and a number of others I think whose names I see here. So thank y'all so much. Dr. Fraser.
Thank you, everyone, for coming. I wanted to especially thank Dr. Smalligan for sharing with us, and to your student guests that came. Thank you so much to hear that you joined us from your away rotations. I know that's a busy time for you, so thank you for taking some time out of your day and schedule to be here with us, and to share about your experiences. So we are working on an upcoming CME series in the fall. So if you are one of our alumni audience members and you're interested in earning some CME credit, we will have more information coming out about that series in the following weeks. So just kind of stay tuned on your email. And